All of us are going to experience trauma by seeing this pandemic work in our patients and in ourselves, and sooner or later is also a patient, based just on the nature of what we do. It's not really a matter of if, but when and how we are going to be affected by this pandemic and the trauma that we are seeing. Hi, my name is Noor Ferrell. I'm a psychiatrist in Houston, Texas area, and I was asked to provide a few tools or advice on physician burnout, worry, compassion fatigue during this time. I want us all to think about some symptoms or themes that you might see so that you know when you might need to be getting help if you're experiencing like a burnout or worry. Typically feelings of helplessness, hopelessness, chronic exhaustion, hypervigilance, fear, anger, guilt, maybe inability to now empathize with others, might even present as an addiction, in a sense that you can just never do enough. Just being exposed to what we do, there are risk factors that even put us more at risk of having these symptoms. So like if you've had a previous trauma, being overworked, you're taking on too much, lack of experience for the new physicians, maybe even too much experience in the older, more well-versed physicians, maybe working with a large number of maybe traumatized children, and then maybe even having too many negative clinical outcomes depending on which field of medicine you're in. I guess what I want you to take home is remembering maybe the ABCs in the sense of awareness, balance, and connection to kind of help us all get through this. Awareness in the sense of being attuned to your own needs and what your limits are, what your emotions are, what resources you have. So practice mindfulness, practice acceptance, maybe keeping a journal, getting adequate rest, nutrition, exercise, eating healthily, maybe taking breaks, using some sort of relaxation method that's out there, using calming self-talk. When I say balance, this is of course work-life balance in the sense of work, play, and rest. Maybe focus on something practical you can do right now in the moment, maybe trying to normalize some sort of schedule in the extent you can. And then finally, obviously, the most important one I think is connection with ourselves, connections with others. For us as believers, specifically clinging to Christ. And I think communicating is going to break the silence of what our pain may be. Connecting with others offsets our isolation and maybe even increases some validation and hope. The largest support that we can offer is sharing the hope in our Savior, Jesus Christ. And so I want hopefully to instill that, in that we're talking to other people for support, maybe participating in an online support group, seeking maybe individual counseling. And I do want to make it aware that there is now a free online support hotline for physicians run by psychiatrists 7 days a week from 8 a.m. to midnight on doxy.me/physician support line. So I hope this helps. I'm praying for you all. Take care.